Going straight to the infectious disease experts in Boston for answers about the ever-changing coronavirus pandemic. We're joined by Dr. Kristen Moffitt in the Division of Infectious Diseases at Boston Children's Hospital. Good to see you.
Hi, Emily.
All right, so as you know, COVID-19 has a long list of symptoms. Today, though, the CDC narrowed it down, right, to the big three. 96% of all patients develop either a fever, cough, or shortness of breath. About half experience all three. Do we know if that is also true for kids?
So we don't have quite the same level of detail in kids in terms of whether or not the breakdown of symptoms is quite like that. We do have enough data, though, to suggest that, yes, the majority of children who have confirmed COVID-19 do present with either fever or cough, or maybe both. They are a bit less likely to present with shortness of breath than adults are. And the rest of the data we have around symptoms in children suggests that they might be more likely than adults to actually present with relatively mild symptoms of infection compared to adults. And these mild symptoms may look more like a cold. So kids may more likely have nasal congestion and a runny nose or a sore throat, and a bit more so than the adults, the rates of those symptoms in adults with COVID-19.
So the thing about this that kind of caught our attention, it's really a gray area, right? Kids develop fevers, coughs. I mean, my kids, it feels like all the time, a lot of different reasons, but those symptoms, they often go away on their own. We're in a pandemic, though, so how soon do you think parents should call the pediatrician?
So I think, first of all, it would be important to say that anybody with those symptoms should begin isolating and avoid being around other people to avoid spread in the event that those symptoms are due to COVID-19. I think it's reasonable to have conversations with pediatricians relatively early on, maybe if the symptoms have persisted more than a day or two. Families might want to consider talking with their pediatrician a bit sooner, though, if the symptoms seem more severe. The other reason to maybe have that conversation sooner with your pediatrician would be if that child is in a household with somebody who has underlying health conditions that put them at risk for more severe COVID-19 infection, because that may prompt a bit more urgency in testing. And again, if that's the case, then those symptomatic children should be extra cautious about really keeping distance and separation between higher risk individuals.
All right, makes sense. There's so much to sort through. We really appreciate your time, Dr. Moffitt from Boston Children's Hospital. Good to see you.
Emily,